Excellency the President of the Republic of Ghana, President John Dramani Mahama, my brothers, ministers of state hearing gathered, members of parliament, Togbeo, Mamao, we all know that the health sector is a very critical sector, and the health of the people is the wealth of the people. Since the assumption of His Excellency the President, a lot of reforms are ongoing in the health sector. And to tell you the truth, His Excellency the President is a health advocate. He's leading the health sovereignty across the globe. At this point in the history of Ghana, there are three main interventions in the health sector. One is the free primary health care. Two is the national health insurance. And three is the Ghana Medical Trust Fund, popularly known as Mahama Cares. And none of these interventions is a replacement of the other. They are complementing each other. Any country, and in fact all countries, are yearning to arrive at a destination we call universal health coverage. And what is the universal health coverage? It means that irrespective of your status in society, irrespective of your geographical location, you must have access to quality health care. And data has it that all countries who have succeeded in arriving at the universal health coverage have made deliberate effort to invest in primary health care. And so today, His Excellency John Dramani Mahama is investing in the primary health care. Number one, we know that we have the national health insurance. We took the national health insurance from a coverage of 57%. Now, we are, within a matter of 1 year, we are at 66%. Even with that, what it means is that we have more than 11 to 12 million Ghanaians who are not covered by the national health insurance. And so His Excellency said, we have to introduce the free primary health care such that it will be applicable to all the 33 million Ghanaians. So, for the free primary health care, you don't need to pay any money. You don't need to show the national health insurance card. Once you are a Ghanaian, you will benefit from the free primary health care. The free primary health care, as the name implies, is applicable at the primary health care facilities, the CHIPS compounds, the health centers, and the polyclinics. And as I speak to you now, His Excellency the President has directed every district to build at least 2 CHIPS compounds every year. And now we have over 400 CHIPS compounds established and built across the length and breadth of this country. So it's applicable at the CHIPS compound, it's applicable at health centers, and it's applicable at the polyclinics. We are starting the first phase. We are starting with 150 districts out of the 261 districts, of which 9 districts in the Volta Region is part of the free primary health care. We have also introduced what we call container-based CHIPS compound or container-based health centers, which is strategically placed at the lorry stations and the markets. And as I speak to you now, we have completed about 5 of them in the Volta Region and will be doing more. Now, where the free primary health care ends is where the national health insurance begins. But another wing of the free primary health care that is very, very important, as you all agree with me, our health sector in the past has overly been reliant on what we call sick care or treatment. But as we all know, they say prevention is always better than care. Health care is not sick care. And so the free primary health care, the Mahama Care, is also an attempt to reset the health sector to have a comprehensive health care sector and not a sick care. And so there's another leg of the free primary health care, which is the preventive and the promotion aspect. And that will lead us to seeing health professionals at our homes, at our houses. You see nurses coming to take your blood pressure, your sugar level, screening you. And His Excellency the President has directed that at least every Ghanaian must be screened once a year. Now, wherever the free primary health care ends, the district hospitals, the regional hospitals, and the teaching hospitals, that is where you need the national health insurance. So the free primary health care is not a replacement of the national health insurance. And Mama, I have heard that once it is going to be free, then it is going to collapse our health facilities. No. It is free to the ordinary Ghanaian, but it is not free to government. Whatever service the service providers will give, government will pay. So it is free to you, the Ghanaian, but it is not free to government. And there's a whole financing scheme, and this year we have allocated 1.5 billion Ghana cedis to it. In the health sector, if you are rolling out such a policy, you need the equipment and the logistics that will aid the smooth implementation of such a policy. For a very long time in the history of Ghana, we have not seen retooling of our health facilities. Togbo, a health facility is the personnel, the equipment, and the infrastructure. As part of the free primary health care, we are retooling all our primary health care facilities in the country. And so about 24,000 pieces of equipment has been procured, and we are distributing across the length and breadth of this country. Although the district and the municipal hospitals are not part of the free primary health care, but they are benefiting from the retooling. In the National Health Insurance Scheme, there are some diseases that are not part of the National Health Insurance Scheme, like the non-communicable diseases, which is also killing us at an alarming rate. About 45% of our mortalities are attributable to the non-communicable diseases. So that which are not covered by the National Health Insurance, His Excellency has also established another fund we call the Ghana Medical Trust Fund, popularly known as Mahama Cares. And so that Mahama Cares is going to be dedicated towards the funding of these non-communicable diseases. I have established the linkages from free primary health care to National Health Insurance to Mahama Cares. And I'll thank my brother Abuja for advocating and encouraging the contractors to contribute to Mahama Cares. And not only the contractors, I will also appeal to our traditional rulers and everybody, every Ghanaian, to contribute to Mahama Cares. Just recently, His Excellency commissioned the cath lab at Kolebu Teaching Hospital. As I speak to you now, very soon we will complete a cardiology center at Tamale Teaching Hospital and another one at Komfanochi Teaching Hospital. His Excellency the President has directed, as you heard from my brother Abuja, that the next phase will be Ho and Takoradi. And that will be making sense of the medical tourism. And so there will be an establishment of cardiology center in the region. Your Excellency, another very important issue in the health sector is about recruitment. We inherited more than 100,000 health professionals who have been trained and they are at home. We inherited a situation where the former administration had recruited about 13,500 health professionals without any financial provisions. As I speak to you now, we have all of them, all the 13,500 on the payroll, and we are paying their arrears. By the end of next year, we'll finish paying all the arrears. Your Excellency has further directed that we begin recruitment of about 16,000 of health professionals. We have completed 8,000 and we will start the next 8,000 very, very soon. We have another strategy we call Ghana Labor Exchange Program, which we are facilitating to also aid the movement of some of our health professionals to also work outside this country. After all, remittances are also part of the backbone of our economy. And so far, we've been able to move about 4 batches outside this country. We now have America, we have the UK, we have the US also with us signing MOU so that we can aid the transfer or the migration of these health workers into these countries. Again, we inherited Agenda 111 without any reliable or secured funding. When His Excellency John Dramani Mahama was leaving office, yes, he left some uncompleted health facilities, but there was a reliable funding of those health facilities he left behind. Talk about the Eurojet or the NMS. Unfortunately for us, what we inherited, no secured funding. About 4.8 billion Ghana cedis have been invested in the project, but not a single one of these projects have been operationalized. His Excellency the President is saying that we should not abandon any of these projects. So what the President has directed is that we have prioritized 35 of them that we are investing in, and about 2 of them are coming from the Volta region that we will invest in and then complete. Your Excellency has also directed, as part of the manifesto, we promised that we were going to build 6 regional hospitals. In the 2026 budget, a provision was made for 3. And so this year, we are beginning the construction of 3 regional hospitals, and he has further directed that in the next year's budget, we are going to see another 3 that will also commence construction. And so in the health sector, there are a lot of reforms and programs, and I am fortunate to have a president who is so much interested in the health sector, and in fact, he's my chief advocate anytime we go to cabinet. I'm most grateful for the opportunity. But since my brother has